Dr. Elisa Song is an integrative pediatrician, pediatric functional medicine expert, and a mama. In her integrative pediatric practice, Whole Family Wellness, she's helped thousands of kids get to the root cause of their health concerns, and she's helped their parents understand how to help their children thrive, mind, body, and spirit, by integrating conventional pediatrics with functional medicine, homeopathy, acupuncture, herbal medicine, and essential oils. Dr. Song created Healthy Kids, Happy Kids as an online holistic pediatric resource to help practitioners and parents bridge the gap between conventional and integrative pediatrics with an evidence-based pediatrician-backed approach. It is an absolute pleasure to welcome Dr. Elisa Song to the show.
All right, Dr. Song, I have been waiting for this podcast interview, and thank you so much for being available. I know you have a busy pediatric practice. It's an integrative and functional approach. I love everything that you put out online, and you're a beacon of light and hope, and you educate, which I really appreciate. So I'm so happy to have you here today.
Oh, thanks, Kelly. I'm so excited, and I'm honored that you said that, because really it's about education, but it's also about hope. And I mean, you and I are moms, right? We don't just want a flood of information thrown at us. We want to know, okay, what are the action steps that actually will lead to a positive outcome, right? We need to have hope and actionable items and doable items to really help our kids be healthy and thrive. So I'm honored to be here.
Yeah. I mean, none of us as moms want to feel hopeless. We want to feel productive, and we want to know that what we're doing is making a positive impact. And I mean, honestly, that's why I host this podcast, just to get the information out there to people of all ages. And a lot of it does parallel my own life. I have 2 young kids, preschool age. You know, they're bringing home the colds. We go to the well checks. We're doing the thing. So from your approach, what is the difference between, say, a traditional pediatric practice and what you do in a functional pediatric practice, or your integrative approach?
Yeah. And I love that you said functional and integrative approach, because it's not, in the quote old days, my approach might have been considered alternative. And I really do not think this is an alternative. This is the way we must practice medicine for our children. The future of pediatrics is going to lie in personalized medicine. It's going to lie in, really taking that individualized approach, because we have this unique child in front of us with all of their genetic susceptibilities. And we know from a functional medicine standpoint how your child's genes, I mean, I'm an identical twin, and, even our genes that are the same interact differently with the environment we're faced with, whether that's the food we're eating or the thoughts we're having or the infections we're exposed to. So how do we then build up that genetic resilience so that our kids are not facing what is looking like, an unacceptable, well, it's not even looking like, it is an unacceptable epidemic of chronic pediatric disease. I mean, the statistics are really mind-blowing, that now over 1 in 2 kids has some sort of a chronic diagnosis. And this was 2005, what is that, 17 years ago. We're heading on, 2 decades, where the New England Journal of Medicine published a study that predicted that for the first time in history, our children were expected to have a shorter lifespan than us, their parents. That should have been a wake-up call, almost 20 years ago. And the reason is because of this increase, a surge in what are called lifestyle-related diseases, or non-communicable diseases, where, the World Health Organization is now saying 7 in 10 people worldwide are dying from NCDs, non-communicable diseases. These are non-infectious: obesity, diabetes, cancers, heart disease. All of these things that through the pandemic we've seen are the number 1 risk factors too for serious COVID infection and mortality. And so we need to wake up. This is not the future we want for our kids. We need to really look at how are we going to help our kids thrive. And that really, the way I practice is I do not throw the baby out with the bathwater, right? I totally recognize that there is a time and a place for antibiotics, let's say, right? However, we know that antibiotics can cause a lot of mischief and unintended, adverse consequences to our kids' gut microbiomes and to the developing gut-brain connection, developing gut immune system connection. So how do we take that and, with a functional medicine understanding, know that 1 round of antibiotic especially if they're infants, could lead to an increased risk for allergic diseases, could lead to an increased risk for mental health disorders, even just that one round. So we take that, we use necessary antibiotics, but then we know, all right, the resulting gut dysbiosis to their microbiome, the resulting leaky gut that can happen. How do we mop that up so that we get the benefits of the antibiotics while still thriving and maintaining an optimal gut microbiome? And integrative can mean a lot of different things. I integrate functional medicine, but I also do homeopathy and acupuncture in the office and herbal medicine and mindfulness, mind body medicine. So this is truly, if I could not practice this way for whatever reason, I would no longer be a physician. I would do something else. I've always wanted to open up a restaurant. So maybe that would be my next calling.
Well, that makes sense because food is medicine
That's
for many
right.
of us. So let's unpack what you just said, because I'd love to go down this rabbit hole of antibiotics a little bit further. As a child of the 80s who had small eustachian tubes and swam all the time and had chronic ear infections and sinusitis all the time, I became allergic to every single antibiotic over time.
Yeah.
Cephalosporins, Z-Paks, down to the fact that I was being given like levofloxacin at certain points in high school and became allergic to those. So I have been in my practice and through all of my journey learned like how much that may have dysregulated my own immune system and my own health. And I really, really try to be diligent about not asking for antibiotics when there's an issue. From your standpoint, when are antibiotics the right call, and when and how long should a parent wait to see if symptoms resolve with their child for a cold or a virus?
Yeah, such a great question. And this is, one of the main reasons why families come to me is to really have that opinion from an MD pediatrician to know, are these antibiotics truly necessary right now? What would happen if we held off on the antibiotics for a little bit longer? Are there alternatives that are just as effective from the natural world? I use homeopathy and herbal medicine and acupuncture with amazing effects that might not have the same disruption to the gut microbiome. So these are all questions in partnership with your pediatrician. You as a mom should feel completely comfortable asking, right? This is all about having that dialogue and being a team to really support this child in front of you, who for me is my patient. And so, let's take ear infections. I mean, you said small eustachian tubes. Ear aches are the number one reason for a visit to the doctor's office, right? And we know that, about 40% are going to be viral. Antibiotics do 0 for viruses, right? So we need to remember that. Another 40% probably bacterial, but even among bacterial infections, many are going to resolve on their own if you take a kind of a waitful watching approach. And then, another 10 to 20% are going to be mixed. There can even be, fungus, yeast in the picture. And so the American Academy of Pediatrics, this is years ago now, did recommend for healthy young kids taking that waitful watching approach, just to see, can we get by after a day or two, even with this earache, without needing to use the antibiotics. Now, in the meantime, you're waiting and watching your mom, your kid's crying, they're in pain, right? What do you do? And this is where we have actually evidence-based tools to help support our kids. Remembering that, during the pandemic, evidence-based has been thrown around, right?
Right.
Let's just take a step back and take a look at, what does evidence-based really mean? When the term evidence-based medicine came out, this is, decades ago, I was in medical school. We were talking, what is evidence-based medicine, right? Evidence-based medicine, as it was initially and truly intended, is taking the current literature that we have, right? Looking at the science, looking at the research with the clinical experience of the practitioner and doing the best for that patient in front of you. Evidence-based means taking the best of the art and the science of medicine. And we've kind of forgotten that. Where's the evidence, right? And so, that's really important to know, but there is evidence. In fact, there's an herbal compound, a combination of garlic and St. John's wort and mullein in an oil that was found in one study to be more effective in reducing pain and resolving the ear infection than amoxicillin, right?
Wow.
Even then, we don't use these anymore, but there were topical anesthetic eardrops called Oralgan that I remember prescribing in residency. So more effective. And you're using it in the ear, so you're not going to have those systemic effects of an antibiotic in your bloodstream, and you're not going to disrupt the gut microbiome, right? We also have, homeopathy. I've had kids where this one child, I'll never forget it. You remember, these amazing stories. And this one little kid, I was wrapping up with a patient. Luckily, it was the last patient before the lunch break. A patient comes in and I just hear screaming and crying and wailing in the waiting room. And, I, as a solo practitioner, I don't do drop-in visits like that, but I went out, I'm like, what's going on? And there's this little kid, he was about 8 years old. And he's holding his ear, screaming, crying. And I said, look, honey, I have about 5 minutes left. Okay, let's just sit tight. And I ran and I got my homeopathic belladonna, which is great for fevers and pain and intense throbbing. So I said, look, take this dose. If I'm more than 5 minutes, take it again, and then I'll be right out. Took the dose. I'm in the other room, finishing up with the patient. All of a sudden, it's quiet in the waiting room. I mean, literally, 5 minutes later. And I come on out, and he's sitting there. He's still holding his ear, right?
Yeah.
And I walk in, and I said, and I bring him in. I said, are you feeling better? How's your ear feel? He's like, well, it still hurts a little bit. It's so much better, right?
That's amazing.
So amazing, right? And so, we have also these amazing tools from an integrative standpoint. And then, what do? I'll write the prescription for the antibiotic and say, look, we're going to try these natural approaches. These are how I help parents gauge when they might need antibiotics. If things are just continuing to get worse and worse and worse over the next couple of days, or, your child's fever lasts more than about 4 or 5 days. With viruses, we expect fevers to resolve within about 3 to 5 days. Or you just have this mama gut feeling that your kid's getting sicker, then start the antibiotic, right?
Yeah.
In the meantime, let's use our natural medicines or homeopathy, teach parents some acupressure points to use and see. I used to write a prescription for ear infection antibiotics every single day, probably multiple times a day, when I was in urgent care. That was like, I felt like a prescription mill, right? Never feels good, right? Since I've started my integrated pediatric practice, I can probably count, now this is now 2004. So again, I'm dating myself. I mean, almost 20 years ago, I can count probably on like the fingers of both hands, the times I've had to write a prescription for antibiotics for ear infection.
Wow.
Right? I mean, so it's amazing. And I know then and parents trust that when I'm prescribing the antibiotics, let's say for a skin infection or for a pneumonia, oh, Dr. Song's recommending it, it must really be needed, right?
Right.
But I don't just stop there, right? We don't want to stop there. We want to say, look, we know that antibiotics are the biggest disruptor to the gut microbiome. Right? So let's take these antibiotics, but how are we going to mop up? And just, your listeners are so savvy, but the reason why we worry about systemic antibiotics is because antibiotics kill bacteria, but they don't distinguish between the bad bacteria, let's say causing your pneumonia, or the really good beneficial probiotic bacteria in your gut. They just kind of wipe out everything. And so, when we take an antibiotic, we want to make sure we're getting all of those good, healthy gut bugs right back in. So this is the time to load up on your fermented foods. Make sure you just double down on your gut microbiome nourishing diet with fiber and phytonutrients. Take a probiotic supplement, and then we make sure that our gut lining has the resources it needs to stay intact and not go on to develop the quote leakiness or increased intestinal permeability that can pave the way for future chronic diseases. So making sure you're getting in, all of your good sources of, if you eat, animal proteins, yes. If you're, plant-based, then making sure you're getting in your legumes and your nuts and your seeds so that we get those amazing sources of zinc and glutamine to keep your gut lining as healthy as possible. And that way, then we don't hold our breath worrying about the downstream problems associated with that antibiotic use. We say, look, it was needed at the time. Let's do some mop up. And then we move on with a fresh, clean, healthy gut microbiome.
I love it. I love these alternatives. And just hearing from you that in 20 years, you can count on two hands the number of times you've written a prescription for an ear infection really says something, because it is the number one thing that's recommended by most physicians and pediatricians when you take your child in with an ear infection. And it is quick and it's an easy fix for them, but it is ultimately causing long-term damage for your child that we can work on, like you said. But I'm curious, when you talk about the garlic and John's wort ear drops and the belladonna and, you know, the probiotics that you recommend, are these things that people can source from the internet, from Whole Foods? I think that's kind of a barrier to entry for people, as they feel like, even though you don't want it to be called alternative medicine, people listening might be like, that feels alternative. Like, where would I even buy that? How can I get that? Do you have brands that you love and trust? Do you have, ones that you recommend? Yeah.
I love talking about the nitty gritty, right? Because we need, we need the how to, and, you know, when I lecture in front of physicians, I can't tell any brands, right? Because that's against, CME, but here I can. And so, yes, all of these you can find at Whole Foods. I caution parents from buying a ton of supplements on Amazon, just because you don't know how those supplements were stored, or sometimes, you know, expiration dates can be a little bit crossed off. And unless, I mean, there are some manufacturers that have their own Amazon store, then I trust. Like, you know, one of my favorite supplement companies is Designs for Health, and they have their own Amazon store front. And so I trust that everything that you get sent from the Designs for Health store is going to be, you know, high quality, stored well, appropriate expiration dates, as opposed to, let's say, buying from, you know, Judy's Health Store down the street who has an Amazon storefront and also selling the very same Designs for Health product. I would caution against doing that. Now, the garlic eardrops, there is an herbal company called Herb Farm, PHARM, Herb Farm, and they have a garlic ear oil that is the exact same combination of ingredients as was used in the study.
Great.
So that's a great one.
We'll link that in the show notes.
Yeah. So they're terrific. The homeopathy, you know, boiron in the little blue tubes, and often I have a little blue tube on my desk, but I don't. But those little blue tubes that you see at Whole Foods, that's what homeopathy is. Some people, when they're entering into this integrative world, will mistakenly call anything integrative or holistic homeopathy, but homeopathy is its own system of medicine. You know, really, you know, centuries of experience, some really good studies, especially with kids. And so those you can easily find on at Whole Foods. And also even like CVS actually has a whole row of homeopathic medicines as well. So those are pretty easy to find. As far as probiotics, now that's, I mean, that's a huge kind of can of worms, right? Because you can't really, you know, open a paper nowadays. Well, who opens a paper nowadays? You can't go through your news feed nowadays without seeing something about the gut microbiome or seeing an ad pop up, you know, about this or that probiotic. And there are many, many to choose from. You know, when I look for a probiotic, you know, what I look for is we have to remember there are 70 to 100 trillion gut microbes in our belly, right? Many, many, many different kinds of species, right? I mean, countless. I mean, we're just at the tip of the iceberg in identifying these. So when you look for a probiotic, especially if you're trying to replenish your gut microbiome after antibiotics, you don't want just one strain. Right? That doesn't make sense, right? You know, let's say there's been a forest fire and, you know, the forest has been leveled out with the fire, the wildfires, right? Are you just going to plant one kind of plant, or tree in that forest fire, I mean, remember the whole vast ecology that was dependent on, all the different kinds of flora and fauna in that forest. Same thing with your gut. It's not just one kind of bacteria that you want to get in. And so what I look for is a probiotic that has many different strains in it. If your baby's about 2 years of age, the infant, the neonatal gut microbiome is a little bit different than the adult type microbiome. Your baby's gut microbiome takes an adult-like pattern after about 2 or 3 years of age. So if all of the people in your family, the little people and the big people, are over 2 or 3 years of age, you can all take the same probiotic, right? They don't need a specific baby or kid probiotic. Now, and in fact, a lot of the kid probiotics are actually the adult probiotic just with the kid label on it, right? So now you know. But look for one with many different strains. The brands, that I use, Claire Labs, Klaire, they've been around for a very, very long time. Very high quality probiotics. They have powders and chewables and capsules. I have to say I've had good luck, when I do stool tests, for my kids, and we talk about poop all the time. So my patients are well versed in poop and what it looks like and what it should be like. So when I've done stool analyses before and after probiotic supplementation, I've actually had kids do really well on the Jarrow probiotics that are really easy to find at Whole Foods, right?
Yeah.
And even the Nature's Way probiotics that are also very good. But I tend to use the ones that are a little bit higher potency. So I'll use Clear Labs, Designs for Health has good probiotics. I really like this one probiotic called Orthobiotic that comes in a capsule and a powder. It's by Ortho Molecular Products. And I'll tell you why. I mean, there's many, many different reasons. So it has a lot of different strains, but it also has one particular beneficial yeast strain called Saccharomyces boulardii that's really good for supporting the immune system in your gut. It's also really good for antibiotic-induced diarrhea, right? So it kind of plays double duty there, or triple duty actually, because it also can prevent pathologic yeast infections from cropping up. There's a reason why a lot of women, when they take antibiotics, all of a sudden their vaginal yeast flares, because yeast is a normal part of our gut microbiome, but antibiotics don't kill the yeast. So imagine you've killed all of the bacteria in your gut. Now the yeast are having their heyday, right? They're like, woohoo, I have all this room to grow, right?
Yeah.
So then the yeast take over, and then they also, take over in your vagina, which has its own microbiome. And all of a sudden we have a yeast infection. So the orthobiotic is great. And it also does not have to be refrigerated. Many do, but this one is shelf stable at room temperature, which is why it's a great one to travel with, as we start opening up our lives during the pandemic and increasing our travels.
Definitely. So many great call outs, and thank you for sharing brands. I know people probably have pads of paper and pens out like I do and just taking notes. We'll put everything in the show notes, but we know our gut health is everything. And so having a round of antibiotics and wiping out all of our beneficial bacteria and trying to recover from that. And then also knowing our young children have quote unquote leaky gut until a certain age. It's just so critical that we're being diligent around making the choice or not
absolutely
to have antibiotics. So now let's jump into gut health, because this is your expertise lies in immunity for kids, wellness for kids, and that all starts in the gut. Mm-hmm. You mentioned using fermented foods, fiber, phytochemicals, like I'm sure berries and polyphenols and all of that good stuff, animal proteins, things high in zinc and glutathione or glutamine. So when you think about, or when you're working with a patient, how do you understand where their gut health is? Like, what kind of testing do you normally do? And then what kind of recommendations do you make with the parents to really work on their child's gut health and thus their immunity?
Yeah. So, I'm so glad you started off by saying how intimately connected the gut and the immune system are. As your baby's gut microbiome is developing, I mean, from the moment they're born, your gut is communicating with your immune system. In fact, 70% of our immune systems lie in our gut. And I'll have parents and kids think about, when you open your mouth, say, ah, and you see their little tonsils in the back of their throat. Your gut has tonsil-like patches lining your entire intestinal tract. And these patches, yeah, they're called Peyer's patches or, gut-associated lymphoid tissue. They are communicating with the inside of your intestine and directly with your blood's immune system. They're that interface. And what's fascinating is they're the first contact, right? These tonsil-like patches in your intestine, first contact with most of the outside world, right? If you think about it, we're one hollow tube. So it's not just what we eat, it's what we're swallowing, the microbes that are passing through us. And so our patches, these Peyer's patches, will sample what's going on in our intestines. And let's say we have, a virus or bacteria that is trying to invade. Those, our guts and immune system will tell our blood immune system, hey, start reacting. This is foe. We don't like that, right? On the other hand, if let's say you're eating some, berries, let's say, and those come down and get well digested and they're, kind of interacting with our gut's immune system. And our gut says, oh, that's friend. We're going to let that in and we're not going to have an immune reaction.
Mm-hmm.
Now, what happens though if you start eating the same foods over and over and over again? And we're in a rush. So we're not chewing, we're not slowing down. Those food particles are not as well digested. So then you have maybe larger proteins like the gluten protein, found in wheat and other grains, or let's say the casein protein from dairy. And let's think, right? Dairy and wheat are the two most common foods that most kids will eat all the time. And so then your intestines are bombarded with those foods. They are inflammatory by themselves. And your immune system says, wait a second, I was okay with this food. Now I'm not so okay with it. This is kind of looking like a foe, right? And in the worst case scenario, your immune system starts to attack, but confuses that gluten protein for a protein in your thyroid, right? Or an antigen in your joint. And all of a sudden, now the attack is on you and we develop autoimmunity. Okay, so that's why we want that variety in, so that our immune system doesn't ever get sensitized to any particular food. And so when we talk about, how do we support our gut microbiome to support our immunity, and talk to parents, I talk to parents and kids, right? It's got to be with the kids. I mean, even as toddlers, even if you're thinking, oh, they're not going to understand, they sure can understand, right? Because they're going to understand how we talk about it as well. So I don't ever like to say a food is bad for you or food's really good for you, because we don't want to have that emotional setup with food. What I talk to kids about is, wow, there's some foods that are so strong for your body, so strong for your mind. And then I get to get a sense of what is important for that child, right? For a lot of teenagers, it's their skin. Guaranteed I can connect your gut microbiome to your skin health, right? Or your hair, right? For some kids, it's being a super fast athlete, running on the soccer field. Or for other kids, it's being able to, play their violin with ease and, being able to be on stage. And so all of those, because of the gut-brain, gut immune system connection, we can tie back to, what? If we ate foods that were really strong for your gut microbiome, those awesome, bugs in your belly, you would be able to run faster, think more clearly, get along better with your friends, like all the things that are really important for them. So that way, then kids start to have more ownership of, wow, okay, I have more gut bugs in and on me than I have human me cells. So yes, I want me to be happy, but that means taking care of the other me that's in my gut. Right. So that way we take a little less battle out of it for parents. And it's not just about parents saying, oh my gosh, you ate that sugary blue thing. Like, what did you do? Right. I mean, and I've been there, right? I've definitely said that to my son, like, what did you just choose to eat? Right. So, but now let's step back. It's all about resilience. That one time isn't going to destroy your gut microbiome as long as we are mindful of making strong choices for our gut microbiome most of the time.
Definitely. Can you talk a little bit about how eating a certain way or living a certain way can support our kids' immune system on the heels of COVID. And, we were talking before the podcast started, there's a flu here and a flu shot there. And there's a lot of things to be quote unquote scared about, or I don't want to say quote unquote. I mean, it was scary. Like, we didn't know what was going on with the pandemic. We didn't have data. Can you talk a little bit about what the data is looking like now and how what conversations you're having with the parents in your practice?
Yeah, absolutely. This is such an important topic because as we head into, time is so distorted since the pandemic. So this is our third fall, winter of the pandemic, right?
I can't even believe it.
Third, yeah. And I will tell you, the conversation we're having now is very, very different than the conversation we might have been having 2 winters ago, right? Because we know so much more. And Omicron and its subvariants have completely changed the conversation. We know now that breakthrough infections, if you had the vaccine, or reinfections, if you've already had COVID and maybe are unvaccinated, they're very common, right? I mean, we all know our neighbors or our friends or ourselves who have had COVID by this point. It's hard to find someone who, is a COVID virgin at this point, right?
Right.
And so we know that now. We do know, the evidence does point to the fact that having been doubly vaccinated for our at-risk, elderly population or those with chronic illnesses does seem to reduce the risk of serious COVID and dying from COVID, right? There's not very clear evidence that additional boosters make too much of a difference, especially if you're not in the high-risk group. We also know that, having had the infection is also very good protection against serious illness and, dying from your next COVID infection. So again, Omicron has changed the conversation because 2 years ago, natural immunity, I was discussing it, right? And theoretically that it makes sense that natural immunity would provide good immune protection, but that was not on the table at all, at the higher, federal level. And now it is. Now it's acknowledged. Okay, if you have immunity from vaccination or natural, prior infection, they both are very good protection. So we now at this point have to stop and breathe and think, where are we now with Omicron, especially for our children, right? And I mean, and many people who have followed me through the pandemic know that my son, we all got COVID back in March of 2020, right after we went into lockdown.
Yeah.
Right. And if you put yourself back in that place and time, which is so hard to do because we were in a state of worldwide panic.
Right.
I mean, that fear that was just this heaviness over us that we couldn't escape. And my son was hospitalized with COVID and had all the signs of heading towards multi-system inflammatory syndrome in children, what we MISC, which was not even described back in March of 2020. We didn't even know what that could be until, spring-ish, May of 2020, when there was this Kawasaki-like illness after COVID. We know so much more, but that moment in time, that moment when I said goodbye to my husband and my daughter at the emergency room door, bringing my son in, I never ever want any parent to go through. I mean, I remember just thinking, saying goodbye to Kenzie and Peter. And in my head, I didn't even want to go there, but I was just thinking, oh my gosh, I have no idea what's going to happen when we step inside. I didn't know if I was going to be able to stay with Bodhi because they were separating, people at that time. And the worst thought was, I didn't know who was going to be leaving the hospital at the end of our stay.
Yeah.
Right. And I just think, for me, life happens in a way that it is meant to. And I truly believe that I was meant to have gone through that so that I could, bring my integrative functional medicine knowledge and my knowledge as a mom and as a pediatrician to parents so that we can stay calm. We can have healthy respect for this infection, but not live in perpetual fear. And now, 2.5 years later, almost 3 years later, we know kids are doing by far, very, very well with COVID, right?
Right.
50 to maybe 90% of kids with COVID in studies are asymptomatic, right?
Wow.
Yes, we hear about MIS-C, but that is still exceedingly rare. And even the vast majority of kids with MIS-C are surviving and recovering completely. Long COVID is scary, but even still for children, much lower risk than for adults. So the question now is, as we're heading into this fall, where it's not just COVID, but there's the flu and all these other germs that kind of laid dormant, what can we do to build our immune resilience so that our kids, no matter what happens, they recover quickly and completely? And this is where, as parents, we need to step back. I've had parents say, gosh, it was so great during the pandemic because my kids never got sick.
Mhm. They
I
never
want-
came in contact with anything that
That's
trained their
right,
immune
that's
system
right.
to be strong.
So, you just said it. They never came into contact with anything that taught our immune system to be strong. We need to take those hits at a measurable rate, with a foundation of immune strength so that our immune system can learn how to do it better the next time. We need that training, and our immune systems have lost that training. In fact, the hepatitis that has been affecting these young children, through the pandemic, some leading to liver transplants and, occasion very rare, but some deaths was really scary to hear. And now the leading theory is that these two viruses, this adenovirus 41 and human herpes 6 virus, which is the virus that causes roseola, two very, very common, should be completely benign illnesses in young children, came together with these young 0 to 5-year-old, kids who didn't have any exposures to other adenoviruses or to other common childhood viruses, so that then when they were exposed to these very common, usually benign viruses, in addition to this one parvovirus that seems like it's associated, completely unequipped and headed into this fulminant hepatitis. And so one of the researchers that identified these 3 different viruses, notes that it was likely due to this lack of immune system training that our children had during the pandemic. So it's like the ultimate experiment in the hygiene hypothesis, right? Where we know being too clean increases our kids' risks of developing asthma and eczema and autoimmunity later on. So now we have to step back and realize, okay, it's okay if your child gets a sniffle now. It's okay if they get a tummy bug. It's okay if they have a sore throat, as long as we know how to support them through it. And when we support them through it and they recover quickly and completely, like we just said, your immune system develops that memory. That's what we were talking offline before, hormesis, this cellular memory of how to do it better the next time. And this is, when we think about this theme of resilience, really has kind of woven through the pandemic. Same thing with mental health. If your children live in a bubble, we're bubble wrapping them, protecting them from every, sadness or fear or worry, their vagus nerve and their minds don't get training. So then when the big stress happens, the only thing they've learned is how to avoid that stressor, and avoidance has been linked with increased risks of chronic illnesses and increased inflammation. So now's the time. Let's see, how do we move forward with building immune resilience? And as you said, it starts with the gut, right? Feeding our gut, all of the gut microbiome nourishing foods, fiber, legumes, whole grain, the colorful fruits and vegetables to get all the phytonutrients in that support our gut and our genes, right? And those fermented foods. And then we have to also think about not just what's nourishing our gut microbiome, but what are the insidious things that are harming our kids' gut microbiome? And it's really in our ultra processed world, we see these studies just came out that ultra processed foods have been linked with a significantly increased risk of Alzheimer's and dementia later on in life. And what are these ultra processed foods? I mean, your listeners are well aware. It's not just a matter of not eating out of a package, because I'm not going to lie, I throw in a bag of popcorn into my kids' bags, we'll throw in bars, but you have to be a very savvy label reader so that you are choosing foods that are minimally processed, still have whole food ingredients that are not ultra processed. Because in the ultra processing, what we see is, all of these food additives, right? These what I call these microbiome mischief makers. And, food additives, one of the fastest growing industries in the world, food emulsifiers, food dyes, all of those added, FDA approved food additives directly cause gut dysbiosis and directly cause leaky gut, right? So we have to be aware of that, and I'm not saying, again, never eat out of a package, because your kids are going to at some point revolt against that, right? To teach them how to make healthier, lateral swaps, these simple shifts. So my kids, my son and his friends, they love Takis. So I always give that as an example, right? Those red dye number 40 roll tortilla chips.
Yeah.
So I'm like, I shudder when I look at the package. So, what I'll tell my son Bodhi, I'll say, look, you can have the Takis, but we're going to choose the ones from Trader Joe's that don't have the artificial dye, that are the same rolled up, you get the same crunch, and they don't have all of these other additives that are going to really, hurt your gut bugs and make it so that, you're not going to be as fast on the soccer field this weekend, or, you're not going to sleep as well. And remember all those worries you get at night. I mean, they're going to be amplified. And so, we talk about how do we make those lateral swaps, those shifts. So that's really important too, because your kids at some point, you have preschoolers. I never thought I would get to the point where my kids were going downtown on their own with their friends, right?
Yeah.
And buying food on their own. So it's important, even when your kids are little, you say, oh, look, did you go down the grocery aisle? They're going to pick out the colorful unicorn with the rainbow stripe thing, right? That's what their eyes going to go towards. So you say, hey, look, well, let's take a look at these ingredients, right? I know it says made with natural fruit flavors in the front, right? But let's look at the back and see, oh, wow, do you see this, FD&C, this blue lake, number 6, and this red dye 40? Did that sound natural to you? And just kind of, even as they're toddlers, introduce them to this idea, not in a more curious way. Like, let's take a look, right? So that they understand the ins and outs of, the deceptive packaging that's going on. I think if kids learn how to read labels in a gut-friendly way, that probably will make the biggest shift in your child's life, right?
Yes.
Because that it could be that one powerful thing, that they take with them as, when they're off to college, or when they're living on their own in a tiny little apartment with roommates, trying to buy food for their house. So, so many things we can teach our kids.
I'm so thankful for you for bringing that up, because it's such a touchy subject online. And in my space and having young kids, I want to expose them. I want to educate them. I don't want to have to say no to things. Obviously, we want to bubble wrap and snow plow and helicopter all at the same time, because we love our kids, and we're like, you think saying yes, it feels like love, but sometimes saying no is love. And empowering them to make those choices, and saying, like, yeah, if you decide to grab yourself the Taki when you're out with your friends and have the red dye number 40, okay, great. But the ones that we're keeping in the house are these ones from Trader Joe's, and having those alternatives, having those swaps, super, super important. And when you think about their immunity and their mental health, and how how integrated it is with their gut health, then you're protecting them. And I always tell Bash, like, my job is to make you feel loved and to keep you healthy. And Chris always says, my job is to keep you safe, because he's the hammer when it comes to like unsafe boy things in our house. But it's hard being a parent. It's really hard navigating social situations, navigating grocery runs. Like, I am thankful. I do take my boys to like a farm stand, and they don't have processed foods there. And I tell them, you grab your basket, you pick the things, pick the colors, we talk about sizes, and I love teaching through food. It makes me feel really empowered in the kitchen to help them learn about it. I hope that, like, when they go to college, they know how to make themselves full meals and shop for themselves. But when you get into the processed food realm and you see the implications for the gut microbiome, whether it's gums, emulsifiers, dyes, oils, sugars. I mean, it all impacts, right? And
Yes.
so I guess my question to you is at what point, I mean, it sounds like you let your son have the talkie, but at what point are you not saying making concessions, but are you saying like, this is your choice? At what age are you em- allowing your child to make choices for themselves? And how do you have that conversation when you're in social situations and you don't want your child to have something or didn't when they were younger?
Yeah. So, I would say start the conversation young, right? I mean, I totally remember, I was at an airport. We were stuck at the Denver airport trying to get home. Peter and Kenzie had taken the flight before, and Bodhi and I stayed. And so, we're sitting there and we're hungry and we're looking for snacks. And so Bodhi picked up a package of gummy bears and he said, "Mom, look, it's healthy. It's gluten-free."
Yeah.
I mean, and so that was a great teachable moment, right?
Yeah.
It was so funny. But you talk to your kids, and like I said, do it with an air of curiosity, not judgment,
And shame. Yeah.
and shame for sure. But when you talk about strong foods from the moment they're, sitting at the table eating solids when they're like 6 months old, I mean, that you cultivate that love of foods that are so good for us, and that self-love that, I'm making these choices because I love my body and I love my brain, and I want my brain and my body to stay strong and healthy. And then, once they start going on play dates that you're not at, or, drop off birthday parties, right?
Mhm.
Or going downtown like my kids are doing now. You want to have a conversation with them before that happens, before they go, right? I mean, being prepared helps you to make so many better choices. I mean, it's just like they say, don't go grocery shopping when you're starving, right?
Right.
You have a plan and you have your list, right? So when my kids go off downtown, like they're probably going to do tomorrow because it's a minimum day, right? We say, all right, well, let's talk about, let's take a look at the past 2 days. How were we on the strong food scale, right? Do you think we could have upped it? Like, were there some areas? Oh yeah, remember over the weekend, we did go out for, an ice cream treat at night, right?
Yeah.
So, when you go out with your friends, let's think about, balancing it out so that, you know, we did have the sugary thing the day before. Let's choose something that is really great, but not the sugary thing, right?
Right.
And so then we plan out, and they tell me, okay, maybe I'll choose, the burrito bowl, and yeah, I won't have the boba tea today. I'll get a sparkling water. So we just map it out to their it's rehearsed in their mind, and they have that dialogue with me, and then eventually they'll have that dialogue with themselves, right? And they can think
Right.
about, or if they decide I really, really want to get that boba tea, let's see, can we get the boba tea that maybe has a little bit lower sugar, and they know how to read the grams of sugar and, how to moderate that. And so let's think about, if you have that now, we are planning to have a barbecue at our house over the weekend. So let's see what kind of choices do you want to make, because you're, Caroline said she was going to bring over your favorite lemon bars, so
Yeah.
we talk about that. And so if we choose that, then let's make sure that we load up with foods that are going to really keep our body strong and our gut strong. So we're going to have an extra serving of delicious, kale salad tonight, or, we're going to have extra blueberries tomorrow at breakfast. And, it's all about balance. I've had some parents, now with the caveat, for kids who are sick with a chronic illness, when they come to me, let's say they have an autoimmune illness, or, let's say we're working on their ADHD or their anxiety, or, they have autism. That is when it is time to really buckle down and be really clean, right? Because we're trying to heal. When you're trying to heal, we want to make sure we give our gut and our brain and our immune system the best chance possible to recover and thrive and become resilient. So that's when I would say, we really want to keep those out. For the most part, though, we want to really try to think about life in terms of a, 90-10, 80-20 rule, so that, we're allowing ourselves some moments where, we can have that thing that maybe is not as strong for us. But 80–90% of the time, we are building a life of resilience. We're using food as medicine. We're using lifestyle as medicine. We're using mindfulness as medicine so that we can, recover really quickly. It's not going to make a dent, right? Because I have some parents, as you learn, right? And it really, as you learn how disruptive to the gut microbiome, these inflammatory foods can be, and the impact that can have on your gut-brain connection, your child's gut immune system connection, it's really easy to swing all of a sudden, oh my gosh, no, we're not ever going to touch that, right? And I've swung through that too, right?
Right. Same.
But we also have to remember sometimes the fear of eating a particular food can be more inflammatory than actually just eating it and moving on and making healthier choices afterwards.
Right.
Right. So, I mean, I don't completely let go, but I know, all right, if I don't allow this and also teach them how to make healthy choices around that less healthy choice, my kids aren't going to be able to be independent and make the choices that I want them to make when they're on their own as adults.
Yeah.
So,
You're modeling that right in front of them. And that is the best way to show them and teach them how to do it. Before we wrap up today, I would love to touch on autoimmunity that you're seeing in children, and what are some signs and symptoms when a child comes to you or a parent's concerned that like maybe there's a deeper, bigger issue. What diagnostic tests and blood tests are you running, and then what kind of autoimmune diseases are you most commonly seeing in your practice?
Yeah. Okay. So let's dive in with also the nitty gritty on, like, if you're listening as a parent, what labs might you go back to your pediatrician and say, hey, could we run these? Because some of these are labs that you can order at Quest or LabCorp, very conventional labs. Other tests are going to be labs that really you would need to work with a functional medicine practitioner to order. But when I have a child in front of me who comes in with immune issues, and autoimmunity, we can have autoimmune reactivity and autoimmune markers for decades before we have an autoimmune disease. Okay. We know there was a study that tracked something called ANA, anti-nuclear antigen, a very non-specific autoimmune blood marker in different age groups. And the age group with the fastest rise in the percentage of people, with a positive ANA were our teenagers, right? And so, now when I do blood work on children, I will check an ANA because ANA it doesn't mean you have an autoimmune disease yet, but it's a little red flag that your immune system is starting to not like itself. So what do we do now to prevent autoimmune disease from happening? So these are opportunities. We don't want to look at these labs and have a what's the right word?
Like a knee-jerk reaction that, oh my goodness, the sky is falling, Chicken Little.
Yes, absolutely. Yes. I mean, these are opportunities, right? And just because you have a strong family history of autoimmunity does not mean that you are, that you're destined to have an autoimmune illness, or your child is destined to have an autoimmune illness, even if they have a positive ANA. We also know that COVID-19 infection, is linked with increased autoimmune markers. Again, not to say that you're going to develop an autoimmune disease, but, with MISC, there's been some autoimmune markers that are found. There's concern, that there is molecular mimicry. What does that mean? That a part of an antigen, something that your immune system responds to, an antigen on the SARS-CoV-2 virus looks like a part, an antigen on our cells. And so when that happens, when you make an antibody against that, particular part of the COVID virus, your immune system can get confused and start attacking a similar protein on your own cells. Now, let's look at the COVID,
Is that just happening with a COVID-19 infection or also with vaccination?
So, great question. I was just going to mention there's a study by Dr. Aristo Vajani and Datis Karazian, 2 studies looking at this molecular mimicry phenomena, and they look specifically at the SARS-CoV-2 spike protein, right? Okay. And the spike protein looks very similar to cells on our mitochondria, right, our energy powerhouses, our cellular energy powerhouses, also to certain antigens on our pancreas, also to certain gut antigens, okay, even to certain brain antigens. That's a spike protein. Now, you get the spike protein from infection or vaccination. So they caution that regardless, right, of whether you've had the infection or the vaccination, this is a potential that could happen, theoretical. They're not saying it's definitely going to, but theoretically, we might see an increase in autoimmunity that attacks our mitochondria, our brain cells, our gut cells, our pancreas, possibly from both infection and vaccination. So how do we mitigate, reduce that potential autoimmune reactivity so that doesn't happen, right? And when you think about what's happening after infection, what is long COVID? Long COVID, very similar to chronic fatigue syndrome, fibromyalgia. What do we see there? We see our mitochondria taking a hit. We don't have the cellular energy, which then leads to actual fatigue, poor endurance, pain. We have, our brain fog, brain can be attacked. We have gut lining. We know leaky gut is associated with, this phenomena called endotoxemia, where these LPS, lipopolysaccharides, get absorbed through a leaky gut lining and increase our risk for sepsis, cytokine storm, neuropsychiatric problems, autoimmunity. And when that happens with COVID, it increases your risk for sepsis. So we know that's happening, right? We also know long COVID, though, there is an article in, I think it was Science magazine. It touched my heart, and it was very eye-opening. There's a whole branch at the NIH investigating and trying to help patients who develop long COVID after the vaccine, because they were being ignored and shunned and saying, well, that's not real. And they ultimately, sadly, had to close the clinic down because there were too many people that they couldn't serve. So we need to have this healthy understanding that whatever happens from the infection could theoretically happen from the vaccine, right? We're triggering a similar immune response. So we know that's not heresy. That's not, anti-science. That actually is what can happen. And, we know also with the myocarditis, the heart inflammation that was noted after, Moderna, the mRNA Moderna and Pfizer vaccines in young men. Yes, it's very rare. It's rare after the infection. It's rare after the vaccine, thankfully, right? But this very large study that looked at different age groups found that for the vast majority of age groups, myocarditis after infection was higher, a little higher than after the vaccine. However, for our young males, it was flipped. Okay, the rate of myocarditis after vaccination and boosters was higher for young men, teenagers to men in their 30s, than after the infection. Now, myocarditis is not the only outcome that we need to look at, but this also is something that has to be part of the conversation. Again, when we think about personalized medicine, at some point we are going to be in a place with precision medicine where we can use our omics, right, our genomic profile to know. There's a field called vaccigenomics. How do we make vaccines that are more effective for certain populations based on your genomics, right? It might be that this little 10-year-old girl actually needs a higher dose than like a 240-pound 20-year-old. There's also a field of adversomics, which is equally important because we want to know not just who and how much is this particular vaccine effective for, but for whom is this vaccine possibly more risky for, and how do we mitigate that? So these fields were, they're happening right now. Nutrigenomics, how do we harness the power of nutrition individually, right? Because for someone, a load of broccoli might be awesome for them, but another person, based on their genomics, they may need to cut back a little bit on that broccoli and sulfur-containing vegetables. So all of that to say, it's coming, it's not there yet, but we need to understand these and look at, all right, how do we can't throw all of our eggs, into one basket and say, vaccinations are going to cure everything, because clearly they're not. They absolutely can reduce the risk for some, but for most of us who are already healthy and young and maybe eating a balanced diet, what can we do to mitigate our risks even further? So again, that all comes down to really looking at the food as medicine, looking at lifestyle. We've exercised. We didn't even talk about exercise, but an article just came out that found that daily exercise reduced your risk of serious COVID. Now, how much exercise? Not a lot. 20 minutes of moderate exercise a day, or about 10 minutes of high intensity exercise. Right? I mean, you could do that. Go for a walk after dinner around the block with your kids, right? I mean, 20 minutes right there. And that significantly reduces your risk of COVID, right? They found that in cultures that ate fermented foods, there could be a lower risk too. The phytonutrient index and vitamin D levels, I could talk about vitamin D forever, but, in terms of, parents wanting to know, all right, my kids aren't eating a rainbow just yet. What else can we do? I mean, there are certain supplements that I think can be very helpful, and vitamin D is number one, right? As we head into the winter. I mean, if you could get your vitamin D levels optimized. So that was a long tangent to say, what lab work do I order? Okay.
Yeah. Wait, I mean, I think I really want to just address this, because coming off of what we're saying here, which is almost 3 years, 2.5 years of fear and anxiety and stress, and watching, just families go through devastation throughout the beginning of COVID, and not knowing much about it, especially like I have to address you and your son, Bodhi, going to the hospital that day. It's gut wrenching and heartbreaking for me to think about you going through that. It's just, you can't put it into words almost.
Yeah.
And so when you think about that, and now looking at, 2 years after all of that had happened, and that the research is coming out, that we've had the vaccine out for a long time, that we're seeing, and we know now things that were marketed to us, that it would prevent contraction, which it doesn't do, that it would prevent transmission, which it doesn't do, that, promises that were sort of made for all of us, like that, yes, you can protect your neighbors and your friends and your grandparents. And we know that hasn't ever been the case, unfortunately.
Yeah.
And then there are ways that we can support preventing long COVID, that a lot of people and young children have already contracted COVID and have a certain level of natural immunity, that making a decision as a family, I think, is important. And looking at exactly what you said, how can we get our kids physically active? How can we get them having polyphenols? How can we get them having fermented foods? There's so much we can do, supplementing with vitamin D, to support their immunity and their resilience to what is now, something that we'll probably deal with forever.
Yeah. 1,000%, right? It's all about building resilience, because there's always going to be the next thing, right? I mean, there's monkeypox, there's the twindemic that never happened the past couple of years, but now the media is saying we might be headed towards that. So we just have to, like I said, we have to have a healthy respect for what's going on in the world, but not a fear.
Right.
If we understand the tools that can empower ourselves and our children to know that we can be resilient, then we can get through anything, right? It's like building grit for your immune system. It's the same thing. You want your kids to have emotional grit. Well, they don't get grit without overcoming challenges, right? And so, I think, you just think we've gone through so many different ups and downs during this pandemic. Fear has been the theme that's really, been, I think, the most inflammatory for all of us. And in fact, this one study just came out last week, as we're talking right now in the interview, that found that psychological distress before getting infected, so perceived anxiety, depression, what were the other measures? I'll look through. Loneliness. Okay. Loneliness. Fear and worry of COVID. Okay. Before getting infected led to a significantly increased risk of developing long COVID. So, we just now have to be in a different place where we're not in this state of fear, this constant fight or flight that is so inflammatory, so immune suppressing, and walk away with the message of we know a lot more than we did 2.5 years ago, right? When we went into lockdown and school shut down, back in March of 2020, we are in a very different place. So moving out of that fear, the fight or flight, moving back into let's build our resilience, including vagus nerve resilience. That is how we're going to overcome anything new that comes our way, right? So it's so key. And, your message of hope and empowerment, I mean, that has to move us forward. We have to focus on how to thrive. And, I've really made a shift during the pandemic. Prevention is great, right? We need preventive medicine. Prevention isn't going to necessarily help you thrive. So we have to move from a prevention mindset where we're focused on the disease or the thing that we're trying to prevent to a thriving mindset. And we hold in our minds the picture of ourselves, our children in their most healthy, happy, vibrant state. That's where we always want to move towards. You have to create in your mind the picture of health that you want to be and you want your children to be, not the picture of illness that you're afraid of and trying to run away from. So that's where moving away from a prevention mindset to a thriving mindset is where we must go for the future of our kids' health.
Well, I think we have to wrap it at that in respect of your time. And we will throw your labs into the show notes, the ones that you love the most. But that's a mic drop for me right there, Dr. Song. I mean, it truly, even just, I know in my day-to-day, I get to a place where I'm like, oh, I'm worried they're going to get that cold at preschool. I saw that kid and, it's not everywhere. And, like you just kind of get in this mode of how do I keep them from not getting sick? And instead it's like, how do I help them be well? How do they thrive? How are our kids the most resilient they can be? And wow, powerful stuff. Dr. Song, I can't thank you enough. This was really an amazing interview and your patients are so lucky. So thank you for sharing your brilliance with all of us and sharing your time in the middle of your busy day. So I appreciate you.
Oh, thank you so much.
Where can people follow along? Where can they learn more? And how can you help?
Yeah.
Continue to help.
The best place is to follow me on my newsletter, my healthykidshappykids.com website. I have articles there. And I, with my newsletter, I'll send information out like being on amazing podcasts like this and sending out more information. And also Instagram and Facebook. And my Instagram is healthykids_happykids. So that's where I post even more than my articles, some of my musings or the latest article that I found in my interpretation.
Yeah, no, I love following along with you. It keeps me motivated and I love all the new science you share. So thank you so much for being here and for all of your time.
That was my honor. Thanks, Kelly.